good country. We need people who are healthy. I think everybody agrees with that. So without further ado, Dr. Lee, I would like to turn this over and talk about your background, what you're doing, and the need from your perspective that we have universal health care. Do you want to talk to you?
So my name is Diana Lee. I am the director of the Odessa Chambliss Center for Health Equity at Bethune-Cookman University. So the Odessa Chambliss Center is a part of Bethune-Cookman, and we run healthcare programs, more like public health programs. So we do a lot of prevention. It is for the university as well as the surrounding community. So of course we also house a clinic for the working uninsured that is called the Volusia Volunteers in Medicine. We started housing the clinic in September of 2015. So I can share with you the population that attends the clinic. I think you would be very, very surprised. In fact, this morning I went for a walk with a friend of mine, and she said to me, she read a book that was very interesting about people that are recently released from prison, and she said, maybe this is the population that you see at the clinic. And I said, not really. We see at the clinic from attorneys to people that are employed, because the clinic is for the working uninsured. So it is that population that don't make enough money to pay for healthcare, because healthcare is so expensive. So they don't have the choice of being able to pay for it. So one of the things that I have learned since we've been housing the clinic is that the population that doesn't have insurance is greater than we realized. And while we started the clinic, we also have had a navigator on site, just to make sure that if somebody is able to get health care, that they do. And the people that have been able to receive health care through the Affordable Care Act have been tremendously impacted by that, where, it has saved their lives. They have been diagnosed with cancers and being able to have that, extracted. And so, I have seen this firsthand where people are being saved by this clinic that is serving a population that needs the health care. Now, I must share with you, I am originally from Mexico. I was born and raised there. I married an American, that's why I'm here. But Mexico, which is a third world country, has universal health care. I was just there, is that something? We have our healthcare system here in the United States is #1 in the world in expense, of course. It's the most expensive healthcare in the world. And we know that when it comes to efficiency and all of that, I think it's number like 29 or 30. It's not, it's not there. It's not like we're getting, what we're paying for. In Mexico, I was visiting my mother in March, and she was not feeling well one day. We went to, it's sort of like a hospital and clinic. It has the clinic in there. And so we went there because my mother is older and she has a chronic illness, high blood pressure. They are able to see her on the same day. So she can do walk-ins. There's certain people that can do just a walk-in. And it was phenomenal. The physician saw her, did an assessment. She left that place with the medication on hand. Yeah. So, when they talk about countries like Norway and Sweden that have socialized medicine, and those people are super healthy, there has to be a correlation here. So, absolutely. I'm one that I do believe that's probably the way we need to go. So that's my spiel.
I've been practicing for 47 years, so I have seen a number of changes in mental health over that period of time. Psychologists listen better than we talk, so if you don't mind, I'm going to ask you some audience participation questions. How many of you personally know or are related to an individual who's been diagnosed with depression, anxiety, or another mental illness? Thank you. What about, have suffered a trauma, people you know who have been traumatized, yes?
With our medical education system and the load of debt that doctors come out with, there's a fear-based incentive to subspecialize into fields that mostly receive reimbursement without using insurance. Plastic surgery, dermatology, cosmetics, or those like GI, radiology, and other fields, subspecialties, again, very necessary, yet they receive more reimbursement than the average general practice primary care pediatrician, which has a larger knowledge base and they're responsible more for your health care. They're your quarterback. So, why I care is because I also have pre-existing conditions that I became a patient. Around 7 years ago, I developed some very severe health problems. I was trained to become a surgeon, and the life was too stressful for my health. So I spent the last 7 years recovering, which made me even more greatly appreciate my parents, who are my biggest influence as family practitioners in Kentucky, that still do things the right way, taking time with patients. The new corporate influence in medicine is for doctors to become employees rather than small business owners. And within that structure, are you still having trouble hearing?
Yeah,
You turn it up, right?
Keep it right.
Keep it right in front of your mouth.
Because your accent.
That's my accent. I need an interpreter, sorry. So essentially, my parents are both family practitioners, and at the age of 10, I decided that's what I wanted to do as well. So I devoted a big portion of my life.
In ICU and all that, he would be paying that for the rest of his life. So that might be his opportunity gone to buy a house or those type of huge things that are ruined when they see you owe, hundreds of thousands of dollars in debt. As you know, it's highly individualized, and so there's no pat answer for anybody that has that. But if you're pregnant, guess what? You need health care. And the reasons why most of the European countries, and actually I was looking through the statistics, guess who else has a better infant mortality rate than we do?
Russia.
Yes, Russia. You're right. But